Depressive Disorders from Brian Levy, Dennis Julia, Viola, Gianna Novello, and Canella Caruso will be presenting depressive disorders. Our overview will be as follows: an introduction, forms of depression, background, characteristics and symptoms, causes, treatments of intervention, results of research evaluating the effectiveness of treatment, the media portrayal, as well as the conclusion. Introduction. Depression is commonly confused in today's society. It is the most common mental disorder that affects most people. It affects each person quite differently. It can affect their life, their work schedule, their sleep habits, and their eating habits. Most people are not clear on what makes depression different than feeling sad. Depression is a continuous feeling of sadness that affects the body, mind, and thought process. These people have no desire to socialize and enjoy other people's company or enjoy the activities they used to do. People with a depressive illness have a different time to come through these sad feelings. It's hard for them to put themselves back together. People suffering with this illness require medical treatment in order to get better and feel better faster. Without treatment, people with this illness can have symptoms that may last from weeks to years. Who is affected? Mental illness can directly or indirectly affect all Canadians through family or friends. 20% of Canadians will personally experience a mental illness in their lifetime. Mental illness affects people of all ages. Doesn't matter of their education levels, regardless of how much money they make, and doesn't matter on their culture. Approximately 8% of adults will experience major depression at some point in their lives. About 1% of Canadians will experience bipolar or manic depression. Forms of depression. Persistent depressive disorder is also called dysthymia, is a depressed mood that lasts for as long as 2 years. A person diagnosed with persistent depressive disorder may have some episodes of major depression along with periods of less severe symptoms. To have persistent depression disorder, the symptoms continue for 2 years. Prenatal depression is a lot different than having baby blues. It's a full-blown major depression during pregnancy or after delivery called postpartum depression. These feelings of sadness, anxiety, and exhaustion accompany prenatal depression, making it difficult for these new mothers to take care of themselves and the babies. Psychotic depression occurs when a person has severe depression plus some form of psychosis, such as delusions or hallucinations, where they see and hear things. Seasonal affective disorder is characterized by the onset of depression during the winter months, where there is less sunlight. This depression usually subsides during spring and summer. Winter depression typically is from social withdrawal, increased sleep, and weight gain, and returns every year in the winter. Bipolar disorder is different from depression. They experience episodes of high and low moods, also called mania or hypomania. There are other examples that have been newly added to the DSM-5, which include disruptive mood dysregulation disorder, which is a diagnosis in children and adolescents, and premenstrual dysphoric disorder.
Depression is not just a change in mood. It is a medical condition which affects the emotional, physical, behavioral, and cognitive levels of an individual. Someone who is dealing with depression deals with feelings of extreme despair over a long period of time. Almost all aspects of a person's life will be affected by depression. It can affect their emotions, relationships with family and friends, as well as affect their work life. It is estimated that approximately 121 million people worldwide suffer from depression. People who suffer from depression can also increase their risk in developing obesity, heart disease, stroke, sleep disorders, and lack of education. Individuals that are most likely to suffer from depression include those who are unemployed as well as those recently divorced. Depression is most prevalent in people ages 45 to 64. and approximately 80% of all individuals diagnosed with depression will not seek any form of treatment. The number of individuals diagnosed with depression continues to increase approximately 20% each year.